Almost a third of all people today that are getting diagnosed with cancer are 65 and above. A recent study shows that if you're diagnosed with cancer and you're being covered by a Medicare Advantage plan, you're at a higher risk. Let's talk about it. Now, this widely accepted study was done by City of Hope. City of Hope is a federally recognized comprehensive cancer center known for its state-of-the-art research focused on developing new and better approaches to preventing, diagnosing, and treating cancer. This study shows that far too many Medicare Advantage beneficiaries lack access to optimal cancer care and suffer adverse outcomes as a result. And so we're going to get into the details of what it would look like for someone that has cancer and whether they're on a supplemental plan and the difference that would be with an Advantage plan. And so as I get into that, I just want to do a quick review about the two systems that are available for us when we go on Medicare. It's important to note that we have to choose one or the other. We cannot be on both, and both of those are going to come with some consequences. So first off, one option is to stay enrolled in original Medicare A and B, which simply means Medicare pays first. Now, Medicare doesn't pay anything 100% other than preventive, so most people that stay in this system will get a supplemental plan, also called a Medigap policy, to fill in those financial gaps that Medicare said would be their responsibility, the individual insured's responsibility. In addition to that, we add a prescription drug plan. These are called Part D plans. So in this system, this scenario, one option I have is to be an A and B, have a supplemental plan, and a standalone prescription drug plan. All right? And about half of all people today that are going on Medicare are going to opt for that type of a system. The other half today are opting for what are called C plans. And these are also called Advantage plans or replacement plans. Now, folks, there's only one thing that these two systems have in common, and that is that we have to be enrolled in A and B to have a supplemental plan, have to be enrolled in A and B to have an Advantage plan. And so for most people, Medicare A is free, but B carries a premium. Now, this premium is going to be based upon our income, but to note here, anyone that's single that is making $97,000 a year or less, or a married couple, $194,000 or less, will pay $164.90 for their Part B in 2023. If you're above $97,000 as a single or above $194,000 as a couple, you'll pay more for that. That's called the IRMAs, and I've got a lot of teaching on our channel that you can learn about the IRMAs. Now, if I'm enrolled in the Advantage plan, the same thing is true. I've got to be enrolled in A and B. A is free, B has a premium, $164.90. So either way we decide to use our Medicare benefits, we're going to pay that $164.90. It comes out of your Social Security check, or they will bill you for that on a quarterly basis until you take Social Security benefits. All right, now, these two systems are different. So I want to talk first of all about A and B with the supplemental plan. So the reason people have to get a supplemental plan in original Medicare A and B are because of these gaps. Hey everybody, just real quick, I want to remind you to hit the subscribe button and ring the bell below. Just recently, I had a lady call me and she was scammed 3 times to switch her plans in 1 week just because she didn't have an education. We upload 3 videos every week, and our content is designed to give you the education that you need so you will not make those kind of mistakes. If you subscribe and ring the bell below, you'll never miss an upload. Hope you enjoy the rest of the video. So Medicare A is called the inpatient side of Medicare, and it has 3 gaps. That is a deductible and copays for extended hospital stays and copays for extended skilled nursing stays. Those are the gaps that you as an insured would be responsible for. Right? On the B side, which is all the outpatient type services as well as doctor-related services, are going to be paid to the B, and it too has 3 different gaps. Those gaps include a deductible, co-insurance of 20%, and excess charges that can be charged by physicians. So the majority of people that stay in this system don't like those 6 gaps, and they want to transfer the liability of that to an insurance company. So the insurance company will cover those expenses so they don't have to personally. And of course, as they transfer that liability to the insurance company, we have to pay a premium to that company to take that liability. Now, right now, the top 3 plans are the Plan F, the Plan G, and the Plan N. Now, the F plan is truly a full coverage plan. Remember, we said we have 6 gaps in Medicare. If you have an F plan, it will cover all 6 gaps. Medicare pays first, and the F plan will fill in all the gaps. So people on F plans really should never see a bill. Now, the problem with the F plan, number one, it's kind of expensive, but number two, you have to be born before January 1st, 1955, eligible for Medicare before January 1, 2020 to be able to purchase an F plan. And so there are millions of people who have those. They get to keep them. They were grandfathered in when Medicare made these changes to the eligibility for F plans. So if you're born after January 1st, 55, starting Medicare after January 1, 2020, you cannot get an F plan. So the plan that really replaced that in popularity was called the G plan. Now the G plan covers 5 of the 6 gaps. F covered 6 of 6, G covers 5 of 6. So the one gap that G doesn't cover is called the Medicare B deductible. This year, that is $226. So the first $226 on the B side of Medicare, everything outpatient and all doctor services, would end up as a bill in your mailbox. After that, you have 100% coverage. Now, the plan below that in popularity is called the N plan. It covers 4 of the 6 gaps. Just like the G, it does not cover the B deductible. You would have to pay that. And you also, if you ever have what's called an excess charge, that's when the doctor adds 15% to the bill, then you would be responsible for that. And then you'd be subject to co-pays at a doctor visit up to $20, the emergency room up to $50. So again, that N plan, a little lower premium, and you're going to take on a little bit more liability. But my whole point is this: when we stay in this system, A and B is going to pay first. Our supplemental plan will fill in the gaps, either on almost in full or in full if we get that F plan. And so we pay a premium to that insurance company. Now, for the sake of this video, what I'm going to do, I'm just going to talk about the G plan for now. It's simpler, it's the most popular, and right now that G plan varies throughout the country, but we're going to see G premiums in the neighborhood of about $125 to about $150 a month. Now, there are some states that may be a little bit less, some a little bit more. That kind of gives you a general idea what people that are turning 65, going on Medicare, are paying for their G plan. And keep in mind, folks, when you first go on Medicare, either at 65 or when you retire, you can have any supplemental plan that you want without any underwriting, because Medicare says you have this 6-month window from when you start your Medicare B, where that insurance company can ask you any health questions whatsoever. They must accept all your pre-existing conditions. We call that your guaranteed issue right. All right. And so as you can see, we're paying Medicare that $164.90. We're going to pay $125 to $150 for our G plan, and then we have to add a drug plan to that. And again, this is going to vary. There's some plan as low as $5, some as high as $75, but the average right now is right at $25. Okay, so to keep the math simple, let's say I've got a G plan of $125, a drug plan of $150. For those premiums, what am I paying? I'm paying $1,800 a year. And then I have to meet my deductible once a year, $226. So that's how that package would look financially to you. You pay your B premium. We got to do that either way. And then we're going to pay this extra $1,800 a year in premiums for my G as well as for my drug plan. Now, let's talk about that in comparison to our Advantage plan and the cost of it. And so the majority of companies have a 0 premium plan, which means they don't charge you anything to be on the plan. Now, you paid Medicare, but you didn't have to pay them anything. And the reason for that, instead of paying a premium now, you're going to take on the risk or the liability of copays. So we have copays. If we go to the doctor, it's probably a 0 copay. If I see a specialist, it may be $25 to $50 copay. If I have an MRI or a CAT scan or a PET scan, it may cost me $200 to $250 for that scan. If I go to the hospital, I normally pay about $300 to $350 a day for maybe a week. And so as you can see, I pay as you go. But with this copay system, what they'll do is they'll also hit and establish what they call a max out of pocket. Now, these vary plan to plan and company to company, but these right now are going to be about anywhere from $4,000 to $7,000 if I stay in my network. If I go out of my network, that could bump up to about $10,000. And the only one that can go out of network would be those that are on PPO plans, HMOs. You have to stay in your network. And so we pay copays until we hit the max. So what did I pay for that? Well, I had no premium, but let's say I do get cancer. I can assure you, anyone that gets cancer, if they go to treatment, radiation, chemotherapy, possibly surgery, and the recovery of all that, almost always they are going to max out. So let's keep it real simple. Let's just split the difference here. Let's say the max out of pocket is $5,000 on my Advantage plan. That's what I spent. If I have the supplemental plan, I spend $1,800 a year. And so who paid the less amount? Obviously, someone that has a supplemental plan. And so what happens oftentimes is people focus, whenever they make a decision about coming on Medicare, they focus only on the premiums. And that is not what you need to look at. In fact, I'm going to read an article here to you that affirms to us what we need to be looking at when we get Advantage plans. All right, so let me grab this article. And let me read some of the things that I thought were very, very interesting about this. All right, so this article says, despite Medicare Advantage plans' increasing popularity, several features, notably the cost that older adults face in these plans and the extent to which members' choice of doctors and hospitals is restricted, remain poorly understood. They say here are some essential factors to consider. They talk about the pros and the cons of the Advantage plan. And my whole point in sharing this with you is, yes, the Advantage plan has zero premium, but with that come certain consequences. So if I get cancer, clearly I'm going to spend more money out of pocket on my Advantage plan than what I would if I had cancer I was covered by the supplemental plan. But that is not the whole issue. The other issue will be the providers that are available to us and what's our care going to look like if we're getting treated with cancer under the Advantage plan. Let me keep reading. So this article goes on to talk about the pros and the cons. Now, there are some pros with Advantage plans. Extra benefits such as vision care, dental care, and hearing exams that aren't offered under traditional original Medicare. There's the all-in-one approach to coverage. Notably, a person doesn't have to pay a premium for this plan nor a premium for their prescription drug plan as they would with the supplemental plan, right? It goes on to say, but the negative side, though, is this. Access is limited to hospitals and doctors within the plan networks. All Advantage plans either have an HMO or a PPO network. The original Medicare, traditional A and B, allows seniors to go wherever they want, doctor or hospital, as long as that doctor or hospital takes Medicare, and most do. They go on to say another negative side is techniques to manage medical care that can erect barriers to accessing care. And there's a barrier to get that care. Why is that? Well, for example, getting prior approval from a primary care doctor before you can see a specialist, or having a prior approval for some type of a surgery before that surgery is conducted. It goes on to say financial incentives to limit services. In other words, Medicare Advantage plans are really trying to do everything they can to make their profits, so sometimes that results in limited services to the beneficiaries. They go on to say Medicare Advantage plans receive a set per member per month fee from the government and risk losing money if medical expenses exceed the payments they get from the government. And the last one is the potential for higher costs for specific services in some circumstances. And their example is some plans charge more than traditional Medicare for a short hospital stay or home health care or medical equipment such as oxygen equipment. All right. So what they're saying is that we can't just look at the premium only. Let's keep going. There's a widespread perception that Medicare Advantage plans cost less than traditional Medicare. But actual costs depend on an individual's circumstances and aren't always easy to calculate. In other words, when we look at the premium alone, certainly the Advantage plan looks better because it carries a zero premium. But is that the right way to look at it, premium alone? And this article is saying don't do that. Seniors often consider what they'll pay in monthly premiums alone. And this gentleman says to get a full picture of plan costs, which can vary annually, seniors should look beyond premiums to drug expenses, including which drugs are covered by their plan and at what level and with what restrictions. It goes on to say deductibles. These Advantage plans can charge deductibles for both medical services and drugs. What plans charge for hospital care? Some have daily co-payments for the first week or so. We discussed that. And co-insurance rates for services such as home health care or skilled nursing care. And this means that 20% that you may be liable to pay. And he goes on to say it's really critical that folks dig deep and find out about all the possible costs they may incur in a plan before they sign up for it. And this is one of my struggles with all the advertisements about Advantage plans. They're not digging deep whatsoever. They're just hitting the surface, highlighting those things that differ them from original Medicare. And oftentimes people are induced to enroll in them because those perks sound so attractive, but they really do not know the real cost if they were to get sick and see what they're going to have to incur if they had a real serious illness such as cancer. He goes on to say part of the equation has to be what you'll have to pay if you need lots of care. Now, the max out of pocket in cancer is probably going to be hit. That's why we're saying that $5,000 to $7,000 versus $1,800 in premiums if you're on a supplemental plan. All right. He says, in our experience, that's often more than people expected. And that's my experience, too, as an insurance broker. I see many people that are very disappointed in their Advantage plan whenever they get sick and really have to use that care. All right. And yes, they're popular, but they're popular primarily because of the perks and also because of the premiums. All right. So we can see the cost of our care and we can make that comparison. But let's also talk about the providers. In other words, what providers are going to be available for us?
Hey, my name's Josh Music. And if you've been enjoying my dad Marvin Music's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the difference between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
Well, keep in mind, if I have an Advantage plan, I'm going to be in a network. I'm either going to have HMOs or I'm going to be a PPO plan. HMOs are certainly smaller. We have less providers that take the plan. We have more restrictions on the HMO plans. But the reason people still enroll in HMO plans is because that HMO insurance company puts together a wonderful financial package. Copays are lower. The max out-of-pockets are lower. They usually give some additional benefits such as dental and hearing aids and those kinds of things that are very attractive to people. But again, you have a limited provider network. Now, some Advantage plans are PPO providers. And the difference between these two, PPO is certainly going to have a larger network, not as large as Medicare, because not all providers will take Advantage plans, but it will be better than the PPO. The second difference is this. If you're on an HMO plan and you want to go out of network, other than urgent care or emergency room, that HMO plan will pay nothing. In other words, you do not have any kind of out-of-network benefit on the HMO plan other than urgent care or emergency room. If you take a PPO, we can go out of network. But here's what happens. That's when our max out-of-pocket could easily jump to $10,000. So yes, we can go out, but it's going to cost us more. And more than likely, when people get cancer, it could be possible they're going to have to go outside their network to get the treatment that they want. All right, so we can see the costs are going to be more if I get cancer on the Advantage plan, plus my providers are also going to be less. And this is why, because once you have a supplemental plan, you can go anywhere that takes Medicare. So what I'm trying to say is that Medicare is your network. Any hospital, any doctor, any specialist, any especially hospital, Mayo Clinic, MD Anderson, all those places, City of Hope, all of them are going to take original Medicare with your supplemental plan. So if they take Medicare, they will absolutely take your supplemental plan of choice. All right. Now, fourthly, I also want you to see that there are some problems that are inherent in Advantage plans, just the way that they're designed, especially as it relates to cancer treatment. Okay, so now I'm going to go to the City of Hope letter because I think it's very important to highlight these areas. So we already know about the City of Hope, but here's what their study did. They did a study of 76,655 Medicare beneficiaries who underwent elective inpatient cancer surgery of lung, esophagus, stomach, pancreas, liver, colon, and rectum. Almost 77,000 almost. They found that cancer patients who had their stomach or liver removed and had Medicare Advantage plans were 1.5 times more likely to die within the first month after surgery compared to those that were on traditional Medicare. You'll see why in just a minute. Secondly, they said that Medicare beneficiaries who had oncologic cancer surgery of the pancreas were twice as likely to die within the first month than those that were on traditional Medicare. You see, people with traditional Medicare, they say, were more likely to be treated, watch, at a teaching hospital, which they're saying they believe provides better care. In other words, 23% of those that were on traditional Medicare got to go to a teaching hospital. Only 8% on Medicare Advantage plans were allowed to go to those teaching hospitals. How about hospitals that are accredited by the Commission on the Cancer? Traditional Medicare, 57% of them got treated there. Only a third, 33%, got treated that were on Advantage plans in these kinds of places. And then National Institute of Cancer, their centers, 15% of all people on traditional Medicare got to go there, only 3% that were on Advantage plans. And here's what they're trying to teach us. Traditional Medicare beneficiaries were also more likely to be treated at hospitals with a higher median number of total beds, larger hospitals, ICU beds, operating rooms, and annual inpatient surgical volume. In other words, they were really better hospitals, better capabilities, better facilities. Everything was just better in those situations. They go on to say Medicare Advantage beneficiaries, on the other hand, experienced, now well, listen to this, a delay of more than 2 weeks from diagnosis to first course of therapy. Okay, delayed. It's one of the problems with Medicare Advantage plans with these pre-approvals. Sometimes they're delayed, sometimes they're denied, and sometimes the care is absolutely disrupted by this. So they go on to say this. A reason for the delay could be the required prior authorization that Medicare Advantage beneficiaries have to undergo. Again, that's part of the Advantage system. You have these pre-authorizations and pre-approvals. While this referral process is intended to limit unnecessary medical care, that's how the Advantage plan spins them, it can cause delays for Medicare Advantage beneficiaries who need specialized services such as complex cancer surgery. The study data can inform policymakers and insurers who want to extend the lifespan of cancer patients. That was the whole purpose of this particular study. All right, and then here, I'll just close with this. It says here, as of the end of this current enrollment period, right now going on, about 50% of all Medicare beneficiaries will likely enroll in Medicare Advantage plans. While these plans can provide patients with some added benefits, remember all the perks that come along with that, the reduction in Social Security checks sometimes, over-the-counter cards, allowance for hearing aids, allowance for eye exams, and free gym membership, all those things, those are the added benefits. But here's what happens. A significant missed opportunity exists in the narrow network design that many of these plans utilize. Access to high expertise cancer care, including surgical care, produces better outcomes for patients. All right, those who have traditional Medicare are a result of that. They're seeing that better outcome. And then lastly, it says cancer patients with privatized cost-saving Medicare Advantage plans were more likely than those with traditional Medicare to go to hospitals with physicians less experienced at performing complicated surgeries, and that they were more likely to die within the first 30 days after the removal of their stomach, pancreas, or liver. Folks, these are serious results from this study. And again, it doesn't make Advantage plans bad. But again, when you see all the ads and all the discussion, it's always about the premiums being zero and all the perks that come along with it. But what you need to be thinking about, if I got something serious, am I really going to save any money? And the answer to that is absolutely no. If I get cancer, am I going to see any provider that I want to? On the Advantage plan, it could be limited because you have networks. So let's not just look at the zero premium. Let's not just look at the perks. Let's consider the fact that we could become very ill. We could have some serious illness, could be the heart, could be lung, could be liver, could be cancer. And then you're going to know exactly how your insurance is going to work. And what's going to matter then is, can you go to the doctors that you want to see? Do you have to jump through a lot of hoops for those pre-authorizations? And ultimately, what is that decision going to look like as it relates to the treatment of the cancer that you have to undergo?